Good afternoon, everyone, and thank you for joining the National Organization on Disability webinar series, Mental Health in the Workplace. Today, we're going to be talking about lived experience, but I am going to give a little bit of time here, probably about 30 seconds for everyone to get logged in. So we will be right with you. So as you can see on this slide, we have the pleasure of speaking with Carol Glazer, President of the National Organization on Disability, and Dr. Leah Goldman, licensed occupational therapist, mental health education, and well-being consultant. Today really is meant to be very conversational for the three of us to talk about our own lived experience and share what that has been like, both professionally as well as personally. So I would like for all of us, the three of us here today, to discuss our personal and professional backgrounds, as well as share, as I said, to the extent that we are comfortable sharing, our experience as a professional living with mental health disabilities. Carol, would you like to kick us off?
Sure. Thank you, Felicia. It's great to be with you all. It's so good to see so many people from all over the country here today. My own personal journey with mental illness began 30 years ago with the birth of my first son, Jacob. Jacob was born with a rare malformation of the brain called hydrocephalus, and he had 12 brain surgeries in his first year of life. That's 12, 2 brain infections, and a couple of very unusual and experimental at the time surgeries to correct problems with the brain. There were lots of complications for him. And I pretty much lived in the hospital during that first year. After about 6 months, I would travel to work from the hospital. Those of you who are parents of children who have any sort of chronic or acute medical conditions know that you feel like you're living in a parallel universe. For me, all of the excitement and the anticipation of the arrival of my first child turned to sheer terror in those first months of Jacob's life. And in the ensuing years, there was always the threat that there would be another problem. I would cower under my desk whenever I got a call from the school, because there was always the possibility that we would have to rush Jacob to the hospital again. It was a terrifying experience, and living with that experience on an ongoing basis of having a child with chronic medical issues continues to be a terrifying experience. I was diagnosed with post-traumatic stress disorder several years later. It took me a few years to come out publicly with my diagnosis. I felt a combination of not feeling like I had a right to have this diagnosis because there were so many veterans coming back from war with much more serious, I thought, much more serious issues that they had confronted. There was hypervigilance, there was fear, but I wasn't really quite ready to admit to myself or to anybody else that I was going through what ended up being, in many respects, a change in personality. There's no question that I changed dramatically during that period. And in retrospect, I had as much of a right to be diagnosed with that mental illness as anybody else did. And I still live with it. There are people in the disability community who came out somewhat critical, because indeed it took me a few years. As the head of a disability organization, it took me a few years to come out publicly. I got a little bit of criticism for taking so long. But I really, over time, and then ultimately as a leader, where I got to really think about these workplace issues professionally, really came to terms with it. And I like to think that it has served me, particularly in these times now of, I mean, you name it, job uncertainty, runaway inflation, this toxic political environment. America is suffering right now. And as a leader, I think a lot about what it takes to keep our workers happy, empowered, respected, and a feeling that the future is not as dismal as some may think it is right now. And as a leader, I think it's incumbent on me to create the kind of workplace culture, a culture of empathy, I like to call it, that really enables people to calm down, that really acknowledges that mental illness, particularly anxiety and depression, are on the rise right now. And we have to take care of our people and their families, because this is a family experience. So that's my personal story, and that's my professional side of it. More to come.
Thank you, Carol. Leah.
Thanks, Felicia. Hi, everyone. I'm Leah. I use she and they pronouns. I am an occupational therapist by training and also a therapist. I currently work at a private practice that serves predominantly queer and trans folks. But my personal experience is as somebody who has navigated depression throughout my entire life, which means I've brought that into all of my work experiences. I've had jobs where I felt like I could disclose, times in my life where I felt like I did identify as someone with a disability, and times in my life where I feel like I didn't. I'm really excited to be here. I think talking about differences in how we've all experienced well-being in the workplace is really important. And it's led me, I was a professor for several years creating mental health curriculum for college students. And I think for me, vulnerability and sharing aspects of my own challenges has been really key. And that's as a teacher and as a therapist. I think when we expect that vulnerability from other people, it's only fair to model it as well. So I'm really excited to be here and be in conversation with all of you.
Fantastic. Thank you so much. So from my perspective, it's kind of tough and even more difficult to share my own lived experience when I grew up with the shame of mental illness. My paternal grandmother, Carmen, had significant mental illness, being institutionalized for as long as 7 years at one point. My father and his brother were raised primarily by their sister, Felicia. During my grandmother's last day in an institution, she was given a lobotomy and sent home as cured. Anyone who knows a little bit about history may recall that Rosemary Kennedy, yes, of that Kennedy family, was a lucky recipient of the same solution to her mental illness. Suffice it to say that my family is not the Kennedys. My grandmother was Puerto Rican, spoke very little English, suffered from mental illness, and then the solution rendered her unable to express any emotion at all. This was at the time when you took the good with the bad. It was not a precise science. My father and his siblings grew up in abject poverty in the Bronx. So we never shared this information. We also, and when I say we, I talk about my sister, Andrea, and I, we didn't really think of it as our own story. We certainly did not walk in my father's shoes. He was in and out of reform school. He was a poor young brown boy running the streets of the Bronx. And the person that I first talked to was actually a vocational rehabilitation partner that I had been working with on some programs in the state of Massachusetts. It was very important that I had to, it is a very important relationship. And the reason why I am mentioning it here is that it is really important to my own professional experience, because I had some work to do myself as it related to my own story and that shame of growing up with mental illness. Bill Allen worked for the Massachusetts Vocational Rehabilitation, MRC, and we were working together. As I said, I had a young woman working in my office, and one day she had a breakdown. Now, this is when I was in staffing many years ago, and we really didn't know what to do. My staff was afraid. We were nervous, and we weren't afraid of her. I need for people to understand that. We were afraid for her. We did not feel equipped to deal with the situation as it was occurring. So I called Bill and I told him to get to my office and take care of the situation. He did, and after a few days we spoke, and I told him at that time that the next person you send me better have a disability I can see. Can't do that. Absolutely. Cannot say that as an employer. Should not have that discussion openly, should not feel comfortable having those types of conversations. You should not be looking at people in this way. So why am I mentioning this? Because I'm eternally grateful to Bill Allen for being such a fantastic partner to me and friend. He called me out on my very real bias. And then I told him my story because I could not, for the life of me, really think that I did have this bias, right? Why would I say something like that? Why was I so upset about a person having some type of a mental illness, disability, or however we refer to that? I always use mental illness. But we were able to work through things, right? I dealt with it. He really was very helpful to me. He gave me that safe space that I think we all need in order to discuss some of these things that we're really nervous. You can see that I still have that. As I share my own story, I do include more details. There are more details than I will ever share, but I continue to be comfortable in sharing more. And I've shared it intermittently over time, but never like I do today. And one of the reasons why is because I had long COVID. This exacerbated my anxiety and depression, my own mental illness that I had not acknowledged, right? I could always deal with it myself. I didn't need any help. It was normal to cry in your car, to have a panic attack on the street in Philadelphia, whatever it was. But I did not acknowledge it until that point. We're going to talk a little bit about that a little bit later, but that's just some of my own personal and professional experience right now that led to these things for me and really for my ability to be able to talk about them today. So next, I would go ahead, Leah.
Yeah, I was just going to say, as we all share and talk about our differences in our own experience, I think one of the things we also wanted to talk about next was generational values and how these differ in terms of our own experiences in workplace mental health and really why that matters.
Yeah, absolutely. I think that it really is so important when we think about the generational aspect of that. I know I'm Gen X, so I am a little bit less open, right, about talking about these things. You know, I can tell you that I disclosed, right, really disclosed my own disability for the first time, and especially my mental illness. I have a hearing impairment that I've talked about forever, right? I wear hearing aids. It was fine. I would talk about that. But my mental illness, absolutely not. And I'll tell you, early in my career, as the only woman and youngest woman being in a senior leadership role in the call center business, I certainly was never going to share that I was struggling on any given day. It was all male. As I said, I was the only woman. It wasn't a comfortable place for me to be. I was rough and tumble, right? You were going with the guys, you needed to. So I think that has a lot to do with my own personal experience, but as well as it shaped me, right? As I went through my career and knowing that as, you know, being this age, being of this generation, if you will, I'm more open to it than maybe perhaps boomers. We've seen the studies on it where boomers are like, oh no, I don't want to share my story and I don't want to hear yours, right? Honestly. And that's kind of, you know, it's based on studies and surveys, et cetera. So I certainly don't want to make, you know, that is, you know, that general comment, but, and then it goes to Gen X and we're more comfortable with it. And then millennial, happy to talk about it a lot of the time. And then Gen Z, very comfortable. So what's your experience been like, Leah?
Yeah, I think that's really important insight. And I'm a millennial, and I think there's this expectation that millennials are empowered and open and maybe even demanding in what we require in terms of our mental health and our well-being. And I think a little bit that shifts the onus of responsibility onto us instead of onto the people who are creating and cultivating the workplace environments. And so a little bit I've felt like if I'm not being treated well at work, if my mental health is not being supported, that's my fault. Because I a little bit grew up with the idea that I'm the one who needs to advocate for my own well-being. And so if that's not being taken care of, that's on me. And so as we think about these generational differences, I think there's also some differences here in what we think about in terms of workplace wellness. So this idea of not just thinking about it in terms of people who identify as having disabilities being worthy of having accommodations, but just that almost universal design in that anyone would benefit from having a workplace environment that supported people's mental health. And that's really whether that's about generation or really just approach, that's really the perspective that I'm coming from too. And I think the openness that I've had in my own mental health challenges comes more from having a very privileged and supportive upbringing and less necessarily about how old I am. So I did have a family that allowed me to seek mental health services and friends who I felt open talking about those mental health experiences with, as opposed to feeling a lot of shame. And so I try to, like I mentioned earlier, really model that vulnerability and give people the space to share as well. And some of that is about generation. And I think some of that is about the very specific life experiences that I've had, and then how that crafts what my life looks like.
I also think that it does come down to not only generational, but also when you think about cultural, right? So for me, having a Hispanic father and knowing that it's just not part of our culture, right? So, and whenever I say I'm Puerto Rican, people just look at me and I'm like, I just happen to look like my Finnish mother, right? And they don't understand that really is part of the culture. It's seen as a weakness. So you're not going to share that. And then when you look at it generationally, you add that intersection on top of that, and it makes it all the more difficult for us to really share and be authentic. Do you agree with that?
Yeah, absolutely. I think that things become gendered as well. So I think any type of marginalization that people experience is also going to mitigate how they navigate any type of disclosure, right? Like sometimes it's just actual safety. Like, do they feel safe disclosing something? Will their job be at risk? Can they afford to have their job be at risk? All those things are very real considerations when people are navigating mental health in the workplace. And absolutely, those things are cultural. And I think can become gendered as well, about who's allowed to disclose emotional challenges, who's allowed to show what in some cultures, like you mentioned, Felicia, is viewed as weakness instead of a sort of suck it up type of mentality. And I do think I had the benefit of, at least amongst some people, I grew up in Miami, so that's a very Latinx culture as well. There are absolutely people who feel like mental health is not real. And it's if you're experiencing that, that's on you, that's your own weakness and something that you need to navigate on your own. And I do think the more awareness, the more conversations like this that happen, the more people who are in public view who talk about their own mental health, the more that happens. That's why we see people like Gen Z who are able to be really, really open in their mental health experiences without as much fear of the repercussions.
Absolutely. And I see people in the chat really talking about their own experience, and some of the people that are nervous, right? They talking about returning to work and how you're nervous because you feel like people may think that you're too much to handle, right? And you think about that, it just standalone, too much to handle. What does that mean, right? In the context of everything and returning to work. Thank you for sharing that. I don't see it on the screen any longer, but it really is. It's hard to share that information in an environment and be vulnerable like that. So thank you.
I think it's also as uncomfortable as it is to disclose your own experiences and talk about those experiences. We're also uncomfortable with colleagues who we think might have a mental illness problem. We don't know what to say. We don't know how to approach them. And somebody said recently that if you saw a person in front of you in the workplace fall down, you would quickly go over to that person and ask if they're okay and give them a chance to reach out to you for help. And if you think of mental illness in the workplace in that very same way as any other kind of physical issue that might come upon somebody, it's really okay to ask somebody if they're okay. It doesn't mean you're probing, and you don't have to probe. It doesn't mean you want any kind of personal information that somebody may not be comfortable sharing, but you do want to know if they're okay. And you do want to be able to offer help and support if they ask for it. And so I think we have to get over not only our own discomfort, as many of us are doing here on this call, and believe me, this is not easy if anybody thought it was. But as hard as it is to do that, we have to make it easy, not only for ourselves, but for our colleagues, and to have that kind of conversation in the workplace. I know this starts spilling into our next question, Felicia, but it's definitely true.
No, please go ahead. Let's move into the next question. I think that's a great segue. And that is talking about how, I think, and, we talked a little bit about this before we got on the call, is that there's a lot of pressure put on employees, right, to disclose. There's a lot of information out there helping you, to talk about, and feel free to talk about your disability, mental health disability, whatever that is. However, we would really love to flip that, right? Through this work that we do, we would love for employers to understand what they need to do in order to create an environment where we feel confident in disclosing, where we feel confident in having those conversations. So would love for us to move into that and talk a little bit about what not only can employees do, right? I think that's short. I think you summed it up, Carol, right? What do employees do?
When you speak up and you speak up.
Speak up and speak out, as much as you possibly can. But now, what do employers do? Like, think of it from a leadership perspective, if you will. How can employers really bring this to the state that we need it to be in order for all of us to feel comfortable?
I'm going to take that challenge, Felicia. You invited a talk not only about managing, but also about leading. And certainly as a leader of a disability organization, I think about these issues all the time. And in the spirit of candor that we're creating here in this Zoomcast, I want to talk about a couple of ways that I have failed as a leader to create the kind of empathetic workplace that is so very important to me. And we read a lot nowadays about empathetic leadership, and about the fact that if we're going to create happy employees who feel empowered, feel respected, who are not under constant stress for all the reasons we talked about, but who feel really good about coming to work every day in the midst of a very, very uncertain and somewhat toxic environment that we're living in, you have to be empathetic. And empathy is very, very different from sympathy. Sympathy is when you feel bad for somebody. The extreme of sympathy is pity. That can be very dehumanizing, and we want to be very careful about that in the workplace. But empathy is when you can really put yourself in another person's position, which is what I think leaders today really have to do, and really understand the world from their perspective, not yours. And I've heard about the difference between the golden rule and the platinum rule. If the golden rule is do unto others as you want others to do unto you, the platinum rule is do unto others as they want done unto them. And that's very different. And you take the extreme of empathy and acting on it, and that's where compassion comes in. And I think those two qualities of empathy and compassion are so very important. You have to be vulnerable. You have to be transparent. You have to admit when you don't have the answers to something, which is something that in sort of the days of yore, a leader had to be buck up, be strong, be affirmative, have all the answers, even when you really don't, and really act sure of yourself. Those days are gone today. And with empathetic leadership taking their place. Two aspects of empathetic leadership that I think need more time and attention, and where I didn't pay it adequate attention, were in the areas of self-care and a close cousin to that, self-awareness. A leader really has to, if we want to take care of our people, and if we want our people to take care of themselves, we really have to model taking care of ourselves, not overworking, not being up in the midnight hours. Those of you who know that I sometimes am up in the midnight hours, you should also know that I've probably slept a little bit before then. so that you really have to take care of yourself. You really have to not put yourself under the same kind of stress that your people do. And it's very, very hard to do. And again, it's partly a cultural thing of, overwork and burn the midnight oil and really put that time in is a way that we it's our badge of courage. We have to be really careful about that. And I personally have not done a good enough job about that as a leader. Now, how do I know this? That's where the close cousin comes in of self-awareness. As leaders, we have to be constantly in touch with how our people are feeling about our leadership. It's not always easy to hear the message, and you have to be able and willing to hear the message anonymously, which I have done in many cases. And I have heard that my stresses and my lack of caring for myself can sometimes come off in a way that creates stresses for other people. So I think those two qualities of empathetic leadership are very critical. You can, no matter what else you're doing to create that kind of environment where people feel safe, you have to be able to admit that you don't have all the answers, that you, like everybody else, make mistakes, and you have to be willing to engage in self-care and engage in efforts to get candid feedback from other people. And that's the self-awareness part of it.
Thank you, Carol. Leah, I want you to go ahead and talk about that, but there's something in the chat that I really, I want to point to, and that is, I want to show empathy to be supportive, but I am also not a professional counselor, and I don't know really where to draw the line, right? That is one of the big questions that we always get. Would love to, have your reaction to that as well.
Yeah, I can take that one, especially as a therapist. I can go with that one. Is I think showing empathy is something that anybody can do, and showing empathy doesn't require that you take on or manage the emotional experience of somebody else. So communicating to somebody that you understand what they're going through doesn't have to then translate into you giving them strategies or advice or becoming the person that they now talk to about everything. So that's just, like, being empathetic is kind of like a first line of response that anybody can do while still having boundaries about not taking on those things for other people. I really liked what you were talking about, Carol, about empathetic leadership. And I think sometimes it can be helpful to take it out of the realm of disability for a second. So I'm going to give an example of asking yourself, like, what is the norm of the culture that I'm creating? So for example, part of why people often have to come out as queer is because we have a culture that normalizes or has being straight as the norm, right? So we create this environment where people have to come out as something other than what we've established as the norm. So if you put that like in a mental health context, if you create an environment where the norm is being able-bodied, then now you're putting people in the position to feel like they have to come out as something other than able-bodied. So one thing that you can do is like look at the environment that you've created and say, is the norm here being able-bodied? And is that because everyone else that we've hired is able-bodied, meaning you haven't hired enough people who have disabilities and who have diverse disabilities? And also, have we created a sort of culture of silence where maybe there are people here who have different disabilities, but nobody's talking about it? And so how can you create an environment where everyone is invited to share what they need and what would support their well-being, whether they have a disability or not? So ways that I've seen that done really well are people filling out surveys about how do they feel and take in appreciation in the best way? What would make them feel supported in the workplace? What are ways that they like to receive feedback and ways that they don't like to be communicated with? So all of these things that maybe we think about only in the realm of supporting people with mental illness actually would serve everybody. So you're inviting everyone to provide an opportunity for accommodations, whether they're legally afforded or not. And that also removes the barrier of, to have legally afforded accommodations means you have to have accessed formal services that grant you a diagnosis that then deem you as somebody who has gotten those accommodations. So if you have someone who either doesn't have access to those or maybe has cultural barriers to accessing those services, whatever it is, now you've kind of eliminated that barrier because everyone is just being accommodated, regardless of whether or not there's someone who identifies as having mental illness or not. So I think it can just be really helpful to think about what are the policies, what's the culture that you've created, and have you created a norm for able-bodied people, or are you really an environment where everyone feels like they can exist and thrive?
Love that, right? 2 thumbs up. That's fantastic. It really is it's such a good way to frame things, right? As far as overall, what are you looking at, right? And then how do you want it to be, right? What's the end goal? Instead, we're trying to do other things in the workplace, right? That certainly are very helpful, right? Very helpful to see people that, companies that are really making a major investment, but it does need to be part of your overall strategy. And I'm going to talk about my own experience, and it's a little bit hard. It was my own experience in working through my own breakdown with Carol here at NOD, because I think that it's important to understand that whole empathy and the journey that I took. And the only reason why I think it's important is because, again, it was really difficult for me. And Carol really was a great example of someone during my very great time of need and my ridiculous inability. And I say that of myself. It's, you don't have to categorize that for yourself, but my ridiculous inability to really see that I needed help or to ask for help. Right? That vulnerability, that having come through my career, working mostly with men, right? Going right back to that space of, I'm not going to share the shame of my mental illness. I can't do it. I can't ask for help. That's weak. Carol had conversations with me, knowing that full well, sharing her own experience, some of the things that had happened to her over time, and how she had asked for help, how she needed to go and get help for herself, and clearly identify that Jacob Inc., which is how we refer to Carol, is the CEO of Jacob Inc., her son that we all love so much. But she also needed to be the CEO of Carol Glazer Inc. and ask for help. So she had those conversations with me, which it was, 2 years ago now, right? I had COVID. Everything just came and just, it really did it. Everything just blew up for me. And there were some side effects of that, right? I didn't know, I can't get out of the chair. I certainly can't, I'd fall asleep on calls. I just tear into people. The anxiety was so bad that I had no patience, and I would just lose it. And you can't have that in the workplace, right? You can't foster that behavior. And so Carol found a way to bring that to me and just have the very real conversations about, Felicia, I noticed that, you might be, feeling a little bit frustrated. And I just want to share the fact that completely understand. However, have you looked at the EAP? Have you, looked at the kind of services that we may provide? Then it went from that to, I think that you really, you may want to talk to a professional about some of these things. And let me explain my own experience with that. It may not work for everyone, but it made me see that she was opening a door for me to walk through. And it was up to me to walk through it and say, oh my goodness, like, oh my word, I can't believe this. Thank you so much. Right. I do need help. You're right. I reached out for help. It was hard to get it. Oh my goodness. I live in a rural area. There are no services. I had to get a referral from a friend, right? There's a lot of things that you want to ask your friends for a referral. Their psychiatrist is not one of them, but I did, and was able to move through it as a result of that. But it was really, again, in that moment and in those moments of really terror, paranoia, there were so many things happening, being able to see that door was opened by Carol was amazing and really allowed me to go out. I took a 2-month leave to deal with really getting the help that I needed. And I continue today. Carol.
Well, I was going to mention your leave, Felicia, because I think that especially today, you know, it seems like we're all working more hours. There's just no question. A commute is not the same as working. A commute is a place where, yeah, it may not be a fun experience, but your head is clear. It gives you time to sort of compose yourself, to get ready for the day, to reflect back on yesterday. But when you, instead of going to a commute, when you get up out of bed and you get on Zoom first thing in the morning, it seems lately that, you know, the only flexibility we have is which 14 hours of the day are we going to work? And when people are working that hard, I think one of the most important things you can do as an employer is be flexible about the time that people are working, be flexible about their ability to take some time off when they need to, push PTO. I have to do this at NOD all the time. I had to reprimand our whole staff today to say, guys, take your PTO this summer. People take vacations in the summertime. Somehow or other, people feel that because we're working from home now, that the work isn't as hard. It's not as stressful. It's not as demanding. And the truth is, it's every bit that much. And so I think that kind of flexibility for people and really pushing people. Somebody asked the question earlier of me, Carol, how did you miss the boat on those two critical aspects of empathetic leadership? And what did you do about it? Well, I missed the boat because it is so easy to work your buns off. It's just, you know, especially, and ironically, in my case, a lot of what I was doing and thinking about was how to be a better leader and how to be kinder to people and how to get people to put less pressure on themselves. The irony is that in all that thinking about those things, I kind of forgot about myself. And it's that it's not only, it's the self-care, but it's creating that culture of care, including where people feel that they have an opportunity, but also a need to take care of themselves, to give themselves time out.
I think that's the important, Carol, and it reminds me too of what you were sharing of yourself about modeling those boundaries, of not sending emails at midnight, things like that. Because I think encouraging staff to take their PTO is amazing, but if you're also not taking it, or if companies are glorifying overwork, that I had a previous job where that was the case, where even though they would say, you know, unlimited time off, take your PTO, what was rewarded in that company was overwork. And so what was communicated to me as an employee is you will be valued here as an employee if you do more. If you don't take care of yourself and you work too much, that's when we'll honor you as a good employee. And so I think it can also be really powerful to look at that, right? Like, are we saying things like, oh, you know, kudos to this person for putting in super late hours and crunch time? Like, is that what you want to be rewarding in the company and what you're communicating to employees by doing that? And then also, are you taking time to reward people who do prioritize their own well-being, of bringing attention to someone who did, you know, put a really strong boundary or take time off to support a sick kid or themselves when they needed it? Like, are we bringing positive attention to people when they support themselves and not just communicating that what we value as an organization is, you know, grinding and putting the work in? And I think that's really key too.
Absolutely. I couldn't agree more, Leah. I really think that ultimately it is up to us in leadership roles, right, to make sure that we're setting the appropriate standard for people, that it's not great to work 60 and 80-hour weeks. It's great to work 40 hours and to actually be able to get your work done, right, in those 40 hours. Not always possible, and it may not ever be possible. However, we shouldn't expect 80 hours a week or 60 hours a week in order to accomplish what we need to accomplish from our staff. That's so much stress and anxiety, and sometimes undue. But, you know, we're a very small, I like to say very small, but mighty organization at NOD. And we really have turned a corner as far as our staff is concerned and being able to work together to overcome those challenges. It really has been a great experience. I do like to say though, there are just so many great, I'm caught up in the chat again, because there are so many great comments here. You know, someone just said, right, even a 40-hour work week can be overly demanding, especially for people with disabilities. Absolutely. And that's why we need to have these conversations, right? That's why we need to be able to be open at work, to talk about the fact that maybe we need a flexible schedule. And you know what? I can be more productive in 20 hours a week than you paying me for 40. And I'm really only productive for that 20 hours because you're requiring me to be there, right? Somebody said something about the presenteeism, right? It's real. It's real, it's happening. And what does that do to workplace productivity? And what does that do to you as a person, right? When you feel like you're just phoning it in, that you're doing everything that you feel like you're doing everything that you possibly can, but your production isn't there because you don't have the tools that you need. You haven't asked for the things, and you don't feel comfortable asking for those things.
I think it's also important to have the conversation about the 32-hour work week. And that's got to be, it's a conversation that's taking place in hushed tones in various kind of segments. But the research shows that people are as productive and they're happier, and they're even in some cases more productive when we give people a chance. When you've got to cram all your personal stuff into a 2-day weekend, it makes it impossible to really rejuvenate, restore, and reinvigorate yourself, which is so important when we're working high-stress jobs. So let's have that conversation nationally about the 32-hour work week. It's our culture probably is not ready for it today. Which direction are we going in? It's hard to say because there's so much uncertainty about the future. But it's a viable concept that forces people, if you will, to take that PTO because business is closed 1 day a week. Just want to put that in.
4-day work week. Everybody think about that.
Someone asked too, I saw in the chat, sort of about with this work from home type of culture and with things being more online and on Zoom, what does it look like then? And it made me think about the first time that I saw somebody at my previous job block off an hour for lunch, right? And I had been talking with my own therapist about what would it look like if I just blocked time off to support my mental health? And that was like a revolutionary idea. I was terrified. I felt like I couldn't do it. And the permission giving of just one person doing it, and I was scared to do it because I hadn't seen leadership do it, right? But the first person that I saw do it was not in leadership, actually. And then that gave permission to everybody else to start doing things like that. Block off 15 minutes to take a walk outside in Chicago winter, right? To do all the things that we know we need to do to support our mental health. So I think even if you're not seeing your leadership do it, I'm sure there are other people in your company who, if you do it, that will give them the permission to do it too. And I saw a really interesting question as well in the chat. Lauren Guthrie asked, I feel like it's easier to come out and be vulnerable about mental illness than it is about mental disability. Can anybody else relate to that? And I feel like that's a really interesting question to talk about, and I think relates to the generational initial question as well. About there, I don't think there's a hierarchy of what's harder or not, but I think my own personal experience is that a little touching on what Carol shared in the beginning about feeling like maybe you weren't deserving or you hadn't earned the right to ask for accommodations for a certain disability because there are people who have it worse. We kind of create these like internal oppression Olympics. Like, well, if there's somebody else who has a disability that's going to be more challenging than mine, then I don't deserve to ask for this accommodation, or I'm not going to disclose this. And so I think it's just a really important question that maybe Felicia and Carol, you have some more insight on too about your own experiences. I know I've had times where I felt like maybe I shouldn't disclose this here because I don't have a disability So maybe I shouldn't disclose it, right? And yeah, just thought that was interesting. I'm curious your thoughts.
Yeah, I certainly didn't disclose, right? I didn't think that I had a disability. I would never have categorized it as such. As I said, I don't think, and you maybe don't realize it, maybe you're just thinking, oh, people in, women in leadership positions cry in their car, right? You don't wear makeup to work because you cry in your car. And I cried all the time in my car. And, like I said about the panic attack on the street, right? Well, it was just, bad day. But go ahead, Carol.
There is also, I think, a dynamic, again, as a leader. In some ways, we want our leaders to be invincible. We want them to have the answers. It's somewhat destabilizing to hear, well, you know what? I don't know the answer. I'm not clear about this. I'm not exactly sure what to do or what we will do. There's a way in which it can be destabilizing. I think that people really, as much as we're having this open conversation and everybody on this call, and I love to see the chat box on fire, as much as this is happening, there still is an element to which we feel insecure if our leaders don't have the answer. So I think there is a little bit of ambivalence that a leader may feel, as you were saying, Leah, about coming out with that sort of vulnerability because of a very real phenomenon.
Mm-hmm. And there are people that are sharing their own concerns there about, can you take 2 months off, right? And what does that look like after? Does that affect your ability then to be seen as, a productive person? Will you be seen as someone that can be promoted? Or are we going to have, be having those conversations behind the scenes around, well, Felicia had to take 2 months off for, her mental illness. And really, should she be promoted, right? It's a very real concern for all of us that have a mental health disability. And I think one thing that you can see too is the way the terminology that we use. Leah, I feel like, is very intentional about workplace wellness, right? Using those terms when we're thinking about overall, right? That overarching theme. Carol and I will always revert back to mental illness because that's what we're comfortable with. And then the mental health disability. And it's not only generational, but it's also how we think about mental illness and mental wellness. It goes back to do I have a disability? Do I not have a disability? But it really is, we're trying so hard from an organizational perspective to have that workplace wellness mentality. And I think if we can share that article that Carol shared with us earlier, someone from our team around EY, it's a workplace wellness position, right, Carol, that they created. It was a Forbes article, I think, that you shared earlier. Oh, there it is. Terry just put it out for us, as well as Carol. So I saw some people asking, right, about what are some companies doing on an enterprise level around workplace wellness. EY, I think, is a good example. I think there are some other examples out there of what people are doing and what companies are doing to be more intentional about this, not only from that safe space, right, where we're creating a safe space for someone to go. We're creating those spaces where people can go and meditate or be quiet, etc. Those are all fantastic, but also going back to that policy process, right? We're implementing policies and process that will help us to then bring this to scale across the organization.
Somebody in the chat box raised the question, well, what do you do if you have a leader who's kind of stuck in the old ways of command and control and keeping these things under the radar? And I would just say that I can virtually guarantee you that today, those leaders who felt that way are having to confront the reality, which is 30% anxiety, 30% of your workforce and more, and climbing, are experiencing anxiety. Same number, closer to 40% are experiencing depression. Those are numbers that, as a manager or a leader, or an employer, you cannot walk away from those numbers. You have to be open to the idea. What EY did with the chief well-being officer, that's a C-level executive. And they did it because it was a business decision. It's not a feel-good position at all. And that person makes a lot of other things happen in the organization. But you have to confront the numbers. And I think the time is good. Just show your boss, whoever it is, show your boss those numbers. Show them this article from Forbes. Have them come to events like this. Bring in people from the outside to in town hall style meetings to talk about these issues. I can almost guarantee that people are going to be listening to these things now because this is such a widespread phenomenon. And the race for talent has never been more competitive.
Were you going to say something, Leah? I feel like
Yeah, I was just, as you were, when you said, Carol, that it's not a feel-good position, I chuckled a little, but what it reminds me of is, I think even, I appreciate you saying, Felicia, about like the intentionality of language. I think what happens within this world of sort of like workplace wellness is a lot of actions that don't really hold any value, right? So we love our employees here. We give them free lunch once a week, right? Like that is gestures that maybe even if they have good intent, it's not the same thing as supporting the mental health of your employees. And so I think when companies say, oh, we really support the wellness of our employees, it does sometimes give them an out to do small gestures that actually are not that meaningful, as opposed to making real, lasting, meaningful policy changes in the way that their company is structured and acts. So I've had a lot of those experiences where I can see that there are things that are done to check the box. Someone mentioned even in the chat when I was talking about unlimited PTO, that that's framed as something that's for your own well-being. But really, if you are in a workplace culture where no one takes time off, then nobody takes any PTO and it doesn't actually matter. So making sure that the gestures that, especially if you're in leadership, making sure that if you have an intention of supporting the well-being of your employees by doing some new policy, check with your employees and actually make sure if that makes them feel more supported or if it feels sort of like an empty promise or gesture. And so I think it's not just about making new policies, but checking with your employees about what new policies they actually want and need, and then how the policies that you implement are impacting them.
Oh my goodness, absolutely. Somebody just followed that up, Leah, by saying, we can continue to talk about our EAPs, but we know that, according to Mental Health America's the workplace, mental health in the workplace study, it's less than a quarter of employees. There are over 11,000 that were part of the survey will even look at their EAP resources. So not really, unfortunately, it's not really a great resource for so many of us. So definitely, there's a question in here too, and I want to make sure that we answer it because it's asking about what kind of programming or support does NOD and MHA, Mental Health America, provide for the many, many people who feel the same, especially when it affects their ability, motivation to get care. And they're bringing up Carol's point about feeling worthy to publicly acknowledge, right, the mental illness or PTSD. There are some really great resources on Mental Health America's website that Terry has just shared in our chat. I would highly recommend going there and seeing the types of resources that they do have. For our Leadership Council members that are on this call, please go ahead and visit the Leadership Council members only portal. We will also be sure to share some of those resources when we do send out this recorded webinar. Somebody did ask about recording, and I just want to be sure that you know that when we send the recording out, the chat is not part of the recording when we send it out. So that you will not be able to see that chat. We do want to make sure that people understand that. Then one more question, we're at 1:27, but asking about how do we ask for accommodations at work, right? Especially when you have a mental illness and chronic illness as well. So should I disclose my diagnosis or let them know I can't do certain things, also specifically in retail environments? So do you want to take that one, Leah? Carol, I'm happy to. Leah, no, you can wave this one off. Okay. So disclosing is very personal, right? It's a personal decision. It's up to you to decide, unfortunately. And what really makes us decide to disclose is the greatest influencing factor is when we need help. Many of us will wait too long. I almost did. Many people do the same thing. So when I say, how to ask for an accommodation network, make sure that you are specific with the accommodation that you need. If you're not sure, you can involve your physician in that, in deciding, and as well as in deciding how much you should disclose. Understanding that at that point, your employer can ask you for medical information. They usually have a form that you need to fill out in order to make sure that your disability is covered under the ADA. So Carol, would you add anything to that?
No, I think more and more companies are starting to train their EAP people to really understand the signs of mental illness and be able to tackle them with team members. So give those EAPs another shot. And that is the place that's going to be the first step for employers. But again, the numbers are so high, they're going to have to make these things real. They have no other choice.
Thank you. Leah, did you have anything else that you wanted to add? It's 1:29.
Yeah, I was just going to say, Shirley, that in my experience, it's been helpful. If this is something that feels comfortable for you, is to disclose things upfront as opposed to waiting before it's too late, and to kind of operationalize what that looks like. So when you say like, here's my experience and here are my legally afforded accommodations, and I used to encourage my students to do this as well, is to say like, here's how it might show up. Here's what it might look like. Because then you're giving people in your organization who you trust an opportunity to, when they start to notice those signs, help you, even if maybe you aren't paying attention to those signs as much. So I've had people say, hey, I remember you mentioned that this might happen when you're going into a depressive episode. This is something that I noticed. Do you need support and do you want to talk about it? So that's something that's been really helpful for me with the people that I trust, which is more often than not the HR folks, but that's been helpful for me.
Absolutely. Love it. I do want to just add and end today by saying, previously, I didn't really identify with the statement around being authentic, right? Now I definitely do. I know that by being authentic and feeling more authentic and my own disclosure has made me a much more productive person, both personally and professionally, and definitely makes it so that I am more at ease, more approachable to other people. So it is a very difficult decision to make, but it really does help for you to really be the person that you want to be or hope to be fully, not only just at work, but personally as well. So thank you, everyone. This is fantastic. Really appreciate all of you attending today.
Everyone.
Thank you so much, Leah, for being with us today. Thank you, Carol. Thanks for all of your transparency. Also want to thank our interpreters, ASL interpreters, our captioners, our entire team, World Institute on Disability, Terry Hartman and her team, Terry Hartman Squire, sorry, for all of their help in putting these amazing events on, but most of all to all of you who are attending. Thank you.